So the two work packages where we're really heavily involved in co-leading is work package 3 and 4. So that's for the data access and the data platforming. So Janssen has a long tradition in trying to work cooperatively and partnering with external stakeholders to bring data together in different ways and harmonise data so that we have a common mapping model of data, so it's easier to access, easier to analyse and easier to bring to the relevant stakeholders. So that's a big piece for us at Janssen, and we recognise that as an individual company we cannot possibly achieve the outcomes of a project like Harmony on our own. So the only way to do this is by virtue of collaborating and sitting around the table with a number of stakeholders, which Harmony provides. It's just there for us to work with them. So it's a wonderful opportunity with a lot more contribution, both financially and in terms of subject matter expertise, so you can get to the outcomes that are really meaningful to patients. Absolutely. I mean, for a pharmaceutical company, security, governance, legalities, ethics is high on our agenda, particularly as we deal with patients' data all the time in clinical trials. So for us, it's a very big issue that needs to be addressed, and we'll be making sure that the expertise that we've garnered from doing lots of other projects, both within IMI and other projects, help us ensure that that security piece and the patient consent and privacy issues are well covered and incorporated into whatever models used for the data access and the data platforming. I think that's where the challenge will lie. The technology is not the problem. I think it's about what the data holds currently, where we get that data from, and whether we can get data prospectively to ensure that the outcomes that the other work packages like work package 2 are really trying to define. And so it needs to be meaningful to a multiple number of stakeholders. So the challenge, I think, over the next 5 years is truly going to be being able to find those outcomes which are meaningful to all of those stakeholders. I think it's doable, but it will depend on where the data comes from and what the quality of that data looks like and the security around that data, and making sure that that's all in place. I think just for Janssen it's a really important opportunity. We are very much aligned. We have a credo which has been in place for a number of years, over 100 years, and in that credo our first and foremost objective is to find needs of treatments for patients. So for us this is a fantastic opportunity to find treatments for patients which are meaningful to them as a patient on an individual level. So it's about that patient centricity, it's about precision medicine, all those things that enable the patient to get the right treatment at the right time in the right way. So this is a great opportunity. I'm really excited.